All right, I'm Alex Shank. I'm doing the medical assessment. PPE, and is my scene safe?
Seems safe.
Okay, seems safe. Walking in, the mechanism of injury or nature of illness, it seems like he's having difficulty breathing in the tripod position. Is this my only patient?
Only patient.
Okay, only patient. So then I would call for additional EMS assistance, and based on the nature of the illness, I don't think I need to stabilize the spine, so I wouldn't do that. Then I get into my primary assessment. My general impression is difficulty breathing, patients in the tripod position. Um, Walking in, I could see my patient was alert, so I'm going to give them an A for their level of consciousness. And sir, what do you call the ambulance today?
I'm having difficulty breathing.
Difficulty breathing, okay. So I'm going to get into my ABCs. I'm going to assess the airway, checking for equal rise and fall. I'm going to listen to lung sounds and check the quality of the respiratory rate. Take some deep breaths for me. Okay, how are my lung sounds?
Moving good air, a slight wheezing.
Okay. And so then I would apply oxygen with a non-rebreather mask at 15 liters per minute. And moving on to circulation, do I have any major bleeds?
No major bleeds.
Okay. And how's my pulse?
96 beats a minute.
Okay, pulse is 96. And skin, how's the color of the skin?
Normal.
Normal skin color. How's the temperature?
Normal.
Okay. And condition, is it wet at all?
No.
Okay. So then I would select this patient as a high priority, and we would transport them as soon as possible. And then I would get into my history. So, what were you doing when all this started?
I was just watching TV.
Okay. And does anything make it feel better or worse sitting up?
When I sit up.
Okay. And like, how bad does it feel, 0 to 10?
A 3.
3. Okay. And does it, you feel it anywhere besides in your chest? Does it radiate anywhere?
Just my chest.
Okay. And how long ago did it start?
About an hour ago.
Okay. How about, do you have any allergies?
No.
Okay. And are you on any medications?
I have an inhaler.
Inhaler. Okay. How about your past medical history?
I have a history of asthma.
Asthma. Okay. Probably what the inhalers for. When's the last time you ate?
About an hour ago.
Okay. And what was going on when all this started?
I was just watching TV.
Okay. Having done all that, I would then get into a secondary assessment. It seems like there's a pulmonary issue going on, so I would again get my lung sounds and check the respiratory rate and quality. And how are the lung sounds?
Still wheezing, but breathing is a little bit better.
Okay. And then I would get into my vitals. I would check your pulse. How's my pulse?
90 beats.
Okay. And then I would get your blood pressure. Okay, how's my blood pressure?
112/70.
Okay. And how's my respiratory rate and quality?
20 beats, or 20 breaths
Per minute. Okay.
per quality.
So my field impression is this patient is potentially having an asthma attack, and for interventions, I could call medical direction, help with a inhaler, and I would reassess this patient every 5 minutes since they're a priority patient by listening to lung sounds and checking the respiratory rate and quality.
ALS has arrived.
Okay, ALS is here. So I have my 24-year-old patient here. He called about difficulty breathing. About an hour ago it started. He has a history of asthma. We helped him with his inhaler, and his respiratory rate has gotten a little bit better since. And that's it.